Yeah, we are live. Can you confirm?
Okay, let me check. Yes, you're now live. So we're private before. You're live now. So that means you have to go to the website and edit that. Like alter the link.
Yes, I'll do that.
Okay.
The link has been updated.
Okay. Please send me the link to the website. This one. Right, so our guest will be joining in shortly. All right, Dr. Monica is here with us. Waiting for her to connect her audio. Dr. Monica, can you hear us?
Hi, good evening. I can hear you.
Oh, thank you very much. Welcome.
Thank you.
So our guest is here. We'll be starting very, very shortly. Let's wait for a few more people to join in before we start. All right, I think we should just start. We are already 2 minutes into the program, so I'm sure others will join in subsequently.
Okay, that's fine.
Everybody. Yes, good evening, everybody. Welcome to the October edition of Health Facts Live. And if you're just hearing about Health Facts is, okay, let me put on my video. So Health Facts is a public education platform, a public health education platform, and our aim is to bring relevant basic health education to the fingertips of every Nigerian, no matter your socioeconomic class, your level of education. Our desire and our aim is to make sure important and useful health education is made available to you. So we do this by publishing articles every month, every week, several articles per week. And also once every month, we organize events like this where we invite a specialist to come and talk to us, to shed more light on pressing health issues. So for this month of October, we are focusing on breast cancer. And if you've been following the trend recently, you will know by now that every October of every year is dedicated to breast cancer awareness. And every year there's a different theme to focus on, because breast cancer is a very wide topic. So there's usually a theme every year. So for this year, we have a new theme, of course, and the theme for this year is keeping her in the picture. Keeping her in the picture. So today, joining us, we have Dr. Millicent Maduka. She's a trained and licensed medical doctor. So she's the best person to talk about this because she knows a lot about breast cancer and she's very knowledgeable about the topic. She's an expert in it. So we've invited her today. She's here online with us to talk about breast cancer. And we've tagged this program, Breast Cancer, the Role of Family. And that is in compliance with the theme for this year, the international theme for this year of the October Breast Cancer Awareness. That is keeping her in the picture. So as a way of introduction, breast cancer is a global issue that affects mostly post-pubertal women of every skin tone and color. In Nigeria alone, recent data shows that breast cancer makes up at least 22 to 25.7% of all cancer cases in the country. So this is a very important issue because it affects a large number of people. So that's why we think it's important that we address this issue today. So without any further ado, let me just give Dr. Maduka the floor to tell us more about breast cancer. Thank you very much. Dr. Millicent, over to you, please.
Thank you very much. Good evening, everyone. Like Izini has rightly introduced me. My name is Melissa Maduka, medical doctor, and I was told that I'll be speaking on breast cancer, the role of families today. So the aim is just to enlighten us on what breast cancer is and how we can, the parts we can play in helping those who have breast cancer and doing our own bits to try and reduce our risk factors for breast cancer as well. Now, before we start, I'd like to put up a slideshow that I created for this meeting. But I think I would need permission for that.
You may share your slide.
Okay. Thank you very much.
Hello, excuse me. If you're not speaking, please mute your mic. Please, let's stay muted.
Hello, this is Damola from Ibadan.
Okay.
Welcome, Damola. Please, can you
Everyone see
your
the
mic?
slides so I know I can move on?
I can hear you. I can hear you. I can hear you.
Damola, please, can you mute your mic so that we can give Dr. Maduka the floor to speak?
Okay.
Thank you.
Okay, thank you. Please, can everyone see the slide?
I can't see your slide yet. Dr. Maduka, are you still there?
Yes, I am. I think I'm just having issues displaying the slide on my end.
Okay, we're sorry about that. We're working on it, please.
Okay, so I think I'm having issues on this end, so I think I'll say that.
Okay.
So, before we
Please
start,
hold on.
I'll just.
Dr. Maduka, please hold on, please. Is it okay if we share the slide since you sent me your slide? So is it okay if we
Yes,
share
it's
it
fine.
on your behalf?
Yes,
okay,
it is.
Okay. So I think we'll just do that. We're waiting for the slide to come on. Okay, Dr. Maduka, please, I think we can just begin. I'm sure the slide will come on very soon.
Okay, no problem.
Thank you.
So today, we're going to talk about breast cancer and the role of the family. So in line with that, we would be following an introduction to breast cancer, some of the signs of breast cancer, risk factors, what put people at risk, the treatment, then how to examine the breasts, how an individual can examine their breast on their own, the role of the family, and prevention tips. Now, to start with, breast cancer is a disease in which we call them malignant cells, otherwise known as cancer cells, form within the breast. It could be the fat tissue, it could be the ducts, it could be the gland. But once it's within the breast and you notice, an individual notices that a lump is growing within the breast, then chances are it is breast cancer, though there are other diseases that can happen that can cause a lump to develop in the breast. But once an individual sees a lump and we check it on our end and it's cancer cells, then that is breast cancer. And people might say, how common is it? How common is it? I've barely seen people with breast cancer. But what studies have shown that breast cancer is actually the most common cancer in women. And globally, about 1 in 8 women will develop breast cancer eventually, especially as they age, as they grow older. Now, we might say that, okay, it's only women that have breast cancer, but men do have breast. It might not be, it's not functional to breastfeed a baby, but then there's breast tissue in males too. So males can also come down with breast cancer, although the incidence is lower. It's about 1 in 850 men worldwide, as compared to 1 in 8 women worldwide. Now, so what are the things you look out for when you're thinking about breast cancer? If someone feels a lump in their breast, or they notice that the breast is increasing in size, not both, because usually when people go through puberty, especially females, the breasts grow bigger. But if they notice that there's a change in the size, a woman has fully attained puberty and her breasts have a fixed size, and she's noticing that one is getting bigger than the other, then that might actually be a sign that something is wrong. Or there are changes in the skin or nipples. We call them peau d'orange because what the changes look like the inside of, has anyone ever opened an orange or a tangerine and the inside of it looks like there are dimples within? Those are the kind of changes that can occur to the breast, or even the nipple itself could go inside. Once you just look at the breast and you notice that there are issues or there are changes on the skin, this might actually be signs of breast cancer. Pain could also be a sign of breast cancer, although this is a late symptom. Then the breast could be red. Now, this is actually very hard to notice in Black people because it's hard to notice such skin color changes on the skin. But what they might notice in addition to that redness is pain and tenderness. Touching the breast feels painful, or touching the breast feels warm as compared to the other breasts. And then they could notice swelling in the armpits too. This swelling in the armpit is because there's a saying that every living thing that eats will surely pass waste, defecates. Now, and the body has a way of passing its waste through the body, and we call that the lymph system, lymphatics. So any waste generated within the breast has to move somewhere. And one of the places it passes through is the breast, because there are lymph nodes in the breast. So if there's a swelling in the armpit, it could mean that there's something wrong within the breast and that is just passing through there, and that is where we are noticing the symptom. So if an individual notices any of these changes in their body, then these could be signs that something is actually going wrong in the background. Now, what are the risk factors? Age. As we've known, age is a risk factor for a lot of diseases. As you grow older, the body does not function as it used to when it was younger. The chances of things going wrong increases. So as an individual grows older, the chances of having breast cancer increases. Now, family history and genetics, like when some people want to marry, or some traditions, when they want to marry, they will go to the village to find out things that are common in that family. Does the family have heart issues? Is diabetes common? Is mental illness common? That's because some diseases can be transferred through the genes. So sometimes breast cancer could be genetic. There is a familial predisposition to it. Someone in the family has had breast cancer, maybe from the mother side or the father side, 3 generations down, 2 generations down. Sometimes the family history of breast cancer predisposes the individual to breast cancer, meaning that in that family, in the genes, there are issues. There's the breast cancer gene in the family, and that's why sometimes members of the family come down with breast cancer. Then being female is a risk factor. Like we mentioned earlier, 1 in 8 women will have or will come down with breast cancer as compared to 1 in 850 men. So the chances are higher just by being female. Then radiation. If someone is exposed to high amounts of radiation, they can get breast cancer. Radiation is for X-rays, for instance, we use radiation for X-rays, for CTs, but the radiation level in those investigations, in those tests are actually minimal. They are not the level that will predispose an individual to breast cancer, but those are forms of radiation. Now, obesity. If someone is too big or too obese, too fat, it predisposes them to a lot of issues, heart issues, bone issues. Now, cancer, breast cancer is also one of the things that being overly big can actually cause, or it predisposes you to, increases your chances of actually getting breast cancer. Alcohol is also another issue. We have to take things in moderation. However, when we overdo things like alcohol, it actually increases an individual's chance of getting breast cancer. Now we've looked at the risk factors for breast cancer, what breast cancer is, and the signs of breast cancer. How do we treat breast cancer? Surgery, we have about 4 or 5 modalities for treating it. Now, usually we have a saying in surgery that when there's a growth in the body, you have to remove it and find out what it is. So surgery is one of the ways in which breast cancer is treated, which they remove, depending on how advanced the cancer is, they remove the entire breast, they remove muscles attached to the area, they remove the lymph, the things that drain away the death, so to speak, from that area. Then we also have radiation therapy, chemotherapy. These are drugs and radiations that are given to help shrink the size of the tumor and treat breast cancer. Then we also have biological therapy, that's immunotherapy. This is a newer form of medicine in which the modality, the treatment is tailored to the individual. We're going to check what are the genes the person has, what are the receptors in the cancer cells. It's like medicine specially made for someone, such that if I use this medicine for you, it doesn't necessarily mean that it will work for another person. So that's what we are driving towards in treating breast cancer, and this has had positive outcomes. Now, we've talked about breast cancer in general, the risk factors, how to treat it, what are the signs. As an individual, what can you do to check yourself monthly to detect it early? Because early detection is actually a very key step in preventing breast cancer. Now, for ladies, because breast cancer is more common in ladies, also guys can do this. We call it self-breast examination. Now, as you can see in the picture in front of you, the person that would want to do the examination will have to undress. So in front of a mirror, the person would stare at themselves with their breasts quite visible, and then they will raise their arms to look at the side. What the individual is looking for is, does one breast look bigger than the other? Are there skin changes on the breast? Does the nipple look different? Then you're going to feel within the armpits. Like I said earlier, sometimes the sign of breast cancer could just be a swelling in the armpits because the body has moved the dirt, so to speak, of what is going on in the breast towards that armpit as it's trying to clear out the dirt. And all that might be there could just be a swelling in the armpits. So you have to look there too. Then the breast, you have to feel it up and down and in circles. You are going to touch every aspect of the breast. And it's not just touching, what you're actually feeling for swellings, bumps, lumps, things like, sorry to speak, like when you want to make amala now and then they don't make it well, or ogi and they don't make it well. Some people call it cocoa, other seeds. That is what you're actually trying to feel for. And then we also squeeze the nipple. What we're trying to look for, is there any discharge? Is there anything coming out of the nipple that should not be there? Is it looking milky like a woman is lactating? Is it bloody? Is it fluid? We're trying to look for that because those could be signs that something is going wrong. Now, after examining the breast while standing in front of a mirror, the individual is also going to lie down, and you examine the breast while lying down one at a time, also examining the armpits. Now, if an individual feels that something is wrong, they can feel a lump or a bump, or this is not how the breast felt the last time, then they should go to their primary healthcare provider, who will further check it out and order a series of investigations as required. Not all lumps, let me just say this now, not all lumps is breast cancer. There are so many things that it could be. and some not as scary as breast cancer. So you need, besides checking it out yourself, you also need a healthcare provider to check it for you and do a series of investigations if need be. Now down to the crux of this discussion, the role of the family. Breast cancer can be a scary diagnosis, and it's understandable. But one thing we should know is that cancer is not a death wish, especially if it is picked up early. So what can you do, or how can we help an individual once they've been diagnosed with cancer? Might not necessarily be a close family member, might not even be a family member, could just be your neighbor. What can you do? And some of the things we can help with that is emotional support. They are going through a trying time. They are going through a rough patch. Yes, cancer is not a death sentence, but it takes a lot to adjust to. Changes are happening in the body and you're uncertain about your future. You don't know what will happen. Probably the individual has heard stories of how people died before from it. But so those things can weigh on an individual, and the family should be there to support the person, to put them, to tell them it's okay, everything is going to be all right. You take life one at a time, you take everything one stage at a time, and try and help the individual get through it. Because aside cancer, there are so many things that can affect the quality of the individual's life. Once they be diagnosed with cancer, the person could fall into depression, the person could no longer enjoy their life, see no meaning to their life. And the thing with illnesses is that an individual needs to be prepared for the long-term outcomes, needs to be prepared to fight for themselves. So if they are not in the right frame of mind, if emotionally and mentally they've already given up, that could actually affect the outcome of their care. That could affect how compliant they will be with drugs and medications and treatment regimens. So emotionally, the family needs to be there for their loved ones to make sure that, to tell them that everything is going to be all right. Then financial support. Breast cancer is, like we've established, is more common in females than males. And knowing the kind of society we run, the males attack the breadwinner. And things are beginning to change and women are beginning to get jobs and are able to fend for themselves. But a vast majority of families still run on the premise that the male is the breadwinner and the male is the main financial controller or fender, someone who provides for the family. So because of this, these women need to have financial support. They need to be taken care of. Treatment of breast cancer is not entirely cheap. Healthcare is not cheap. So an individual needs money for the treatment, for the surgeries, for the radiotherapy, for the chemotherapy, for drugs in general. So the family needs support. The man can provide for the family, like money needs to come from somewhere, even if it's not just the immediate family, the extended family, even if the family is not, the way you can support them could just be monetary. I'm sorry, I know things are rough. Here is this amount to help with your drugs, to help with your medication. These actually go a long way, because some of the issues we have in the hospital is that patients cannot afford their treatments. Patients cannot afford their medications. And if the longer an individual delays from not being able to access this care, the more the disease progresses, the worse the outcome becomes, the less likely they are to survive this disease. So finance with breast cancer, then there's caregiving, and it not be able they could do easily. Take for instance, a woman who is a 45-year-old woman now who has 4 children and has to do school runs and feed them, provide in the morning, she wakes up 6 a.m. to get the children ready for school, cook meals for everybody to take to work. And then when they go, she has to stay at home and clean the house. Maybe by 9-10, she goes to her shop to open up, sells for the day, comes back home by 4 p.m. to cook, clean. If such a woman comes down with cancer, cancer can actually take a toll on the body, and she might not be able to do these things that she normally does. So support has to come in the way. If it's that someone will come around to help take care of the children, to help clean the house, she might not be able to do things as effectively as she used to. So the family helping around with those seemingly small tasks can actually go a long way. then the family needs to be involved throughout the course of the condition. The individual should not feel alone, like the battle is just theirs. Having a support system and people around who are involved goes a long way. Someone that will drive you to your appointments to the hospital, someone who is there when the doctor is breaking bad news or trying to tell you the next step of treatment, someone who is there to ask questions alongside you, anything you are not clear on, person is also there, someone who you can talk about your disease with, and someone who would understand because they are there following you through every step of the way. Then understanding and acquiring knowledge about the condition is also important. Once you understand the condition, you're likely to know more about the do's and don'ts. Okay, this person has this condition. The person should not be stressed. The person should eat healthy. The person should avoid alcohol. The person should avoid smoking. Meaning this kind of person should not be going to a local bar or a club where drinking and smoking is done, because it can worsen their health. So knowing about this helps the person tremendously, because one thing about cancer is even if you fight the disease, it can affect the quality of life. So we need to ensure that we're taking care of these other aspects of the person. Then preventive care has to be part of it. Like I said, smoking is a risk factor for breast cancer. Alcohol is a risk factor for breast cancer. So the family can be there to help the person. Take, for instance, in a family in which the man takes alcohol, maybe 1 glass of wine a day, and then the woman has been diagnosed with breast cancer and she has been told not to drink alcohol, to limit her alcohol, then the husband can, because he is trying to help out, decide that for the course of the treatment or for the course of the disease progression, he is going to stop alcohol as well. It's a sacrifice on his end, but it's also a way in which he is playing his part in helping the woman with the diagnosis and to make sure that she has the best outcome. Then clearing misconceptions and myths is actually what it is. They've heard so many myths and bad things about it. Once you have a lump in your breast, if you go to the hospital, you will die. But if you stay at home, that you use this local drug, it can help. Now, clearing all those myths and misconceptions allows people to access healthcare early, allows people to feel like they are not alone, allows people to believe that, yes, they can actually overcome and combat this disease. Joining cancer support groups can also let people see that, yes, there are survivors and that this disease is not the end of the world. Now, I've said prevention tips. Yes, cancer can be genetic and an individual can be more prone to it, but then there are things that can reduce the chances of an individual getting cancer. Just because they have a genetic predisposition doesn't mean they will get cancer. So some of the things that can be done to help reduce the chances of an individual getting cancer includes limiting alcohol intake or reducing it to the barest minimum, because alcohol has been proven to increase the chance of an individual getting cancer. Then no smoking. Aside breast cancer, smoking also causes lung cancer. So the detriments are more than the benefits. So reducing or cutting off smoking entirely can help reduce an individual's chance of getting breast cancer. Eating healthy. I think this cannot be overemphasized. Eating healthy is a prevention tip for a lot of diseases, not just breast cancer, for obesity, for heart diseases, for lung diseases, for liver diseases. Then knowing the signs. Breast cancer caught early, the survival rate is actually very high. If you catch it early and treatment is done early enough, an individual can become a survivor and forget that such a thing ever happened. But if an individual does not know the signs early and disease progresses to later stages, then chances of survival are reduced every step of the way. So knowing the signs early enough and presenting early enough is a way of reducing the risks or the chances of mortality from breast cancer. Then exercise. Maintaining a healthy weight and a healthy lifestyle is one of the key ways of reducing the incidence or risk of getting breast cancer, as well as so many other cardiovascular diseases. Now, in conclusion, breast cancer is not a death sentence. As long as an individual has the right support system and help from family members and community at large, an individual can actually survive this disease and go on to be a survivor and be an ambassador of better health and healthcare within the system. He's trying to find out if anyone has questions as regarding in the management of breast cancer.
Thank you very, very much, Dr. Maduka. Thank you. Although your network started fluctuating towards the end, but I'm sure that all of us participating got the crux of your presentation. Thank you so much. Okay, there's already a question in the chat box here. Someone is asking, can breastfeeding reduce the risk of breast cancer? Okay, I think Dr. Maduka is having some network issues. I'm sure she will join us shortly. All right, so if you are participating on our website or via YouTube, I want you to know that you are still part of us, and feel free to drop your questions, no matter the platform you're participating from. We'll address all your questions. So use the comment section in the app you're participating with, and we'll see your question and attend to them.
Sorry about that.
Okay. Welcome back to Dr. Maduka. So I was saying before you got logged out, someone posted a question in the chat box, and the person is asking if breastfeeding can reduce the risk of breast cancer.
Yes, breastfeeding can. There's something we call exclusive breastfeeding, where a mother breastfeeds her child for 6 months, just breast milk, no supplemental feed. Now, studies have shown that breastfeeding can actually reduce the risk of developing breast cancer. It's not so much, but then it's significant enough that it's one of the reasons why we encourage mothers to breastfeed their babies, because it's also, aside from being beneficial for the baby, it's also beneficial to them.
Yes, thank you very much. So Adebayo A, breastfeeding can actually reduce the risk of breast cancer. So thank you very much, Dr. Maduka. And she has said so many important things in this presentation. We talked majorly about the role of families. Like I said earlier, for those who were not here at the beginning, we said we're addressing this issue of breast cancer this month, for this month's HF Life, because October is actually the month for breast cancer awareness globally. So every October of every year, there is breast cancer awareness throughout the month. So that's why we're talking about breast cancer this month. And for this year, for 2023, the theme for the awareness is majorly on the role of social factors surrounding breast cancer. So the theme is specifically keeping her in the picture. So breast cancer is a very major issue that affects women and men actually, but mostly women, post-pubertal women all over the world. And the condition not only affects the woman or the person with the cancer, it also affects their loved ones, their families. And the treatment or the management of cancer is in the management of cancer of breast cancer is very important that everybody is involved. So that's why we're talking about the role of family. And like Dr. Maduka said, she has mentioned so many things. She mentioned um, the need for financial support because treatment, especially here in Nigeria, where there's little to no health insurance for the average Nigerian, treating a condition like breast cancer can be very, very financially stressful. And many people, there are many cases of women, young, even very young women, dying from breast cancer just because of limitations in finances, financial constraints. Financial, in fact, there's something we say in the hospital that financial constraints is actually the biggest killer in our setting in Nigeria. So she talked about the role of families and loved ones in providing financial support, especially in this our setting. So if you know anybody with breast cancer around you, just help in any way you can because it really makes a difference. Like she said, breast cancer is not a death sentence. There's actually treatment depending on the stage at which it is caught or it is detected. The earlier, if the cancer is in the earlier stage, the prognosis or the outcome is usually better. So there's actually treatment for breast cancer, but treatment involves money. So like she has mentioned, the need for financial support is very important. The need for emotional support also. Here in our setting, therapy is not very, very common. The most common form of therapy right now that is just even getting popular is marital therapy, marital counseling. But I'm sure in the next few years, therapy will become more normalized in Nigeria. So the need for emotional support. There are therapists. We have licensed therapists in Nigeria. So you can help your loved one who is struggling, who is being treated for breast cancer to get therapy. It helps. Like Dr. Maduka said, the mental state of a person suffering from breast cancer or any disease, actually, the mental state of the individual is very, very important. It affects treatment a whole lot. So you can help them emotionally by getting the services of a professional therapist and providing emotional support yourself in any way you can. Then also, like we always say, prevention is better than cure. And in this case of breast cancer, early detection is the best case scenario. So another way you can help to um, keep her in picture, like the team says, keeping her in picture. Another way we can help to keep the women around you, the females around you in picture is by being knowledgeable about breast cancer, like Dr. Maduka rightly said. So you have to know, no matter your gender or your age, it's important for you to know the signs and the symptoms of breast cancer and also know what self breast examination is about. When you know all these things, you can tell the women around you, all the girls and young women and elderly women, your mommies, your aunties, all the women around you. Once you know all these things, you should tell them about it. Many people don't know. Many people don't know the signs of breast cancer. That's why they might notice these changes, but they will not present to the hospital. But like Dr. Maduka said, breast cancer usually presents with pain in the late stages. And many times in the hospital, we see people coming to the hospital mainly because of the pain. Meanwhile, they've been noticing all the other changes, all the lumps, all the coup de ranch, all changes in the breast appearance and the texture. They've noticed all these things and they've been living with it for years. But because they don't know that these are symptoms, these are signs of breast cancer, they will not present because it's not causing them any pain. They will just assume that, okay, it's one of those things. It's one of those things about aging. They might not know. So you having this knowledge and telling the women, educating the women around you is a way to keep her in picture. And also, if you have sisters and any woman around you, please always encourage them, always tell them about self breast examination. Tell them if you don't know how to do it, help them get pictures. There are resources online. Get pictures, show them these pictures, show them videos so that they can know how to perform these examinations of themselves. Thank you so much, Dr. Maduka. You said a lot. I think there's another question right now in the chat box. Okay.
Thank
So I'm
you.
having issue with it. Okay.
Okay,
I
I've
said
seen the
someone is
question.
asking. Okay, yes. Are the signs of breast cancer in women the same in men?
The answer is yes, they are, because the breast is mostly fatty tissue. For women, it gets bigger because of the ducts and all, because it's specialized for feeding infants or babies in children. But the breast anatomy, the basic anatomy is the same in both males and females. The difference is more fatty tissue in the females. So yes, the signs and symptoms are actually the same in both males and females. The issue is just that the breast cancer is.
Oh, I think I've lost you. Dr. Maduka, are you still there?
Yes, I am.
Okay, please, can you repeat what you said? I don't think we heard that.
Okay, sorry about that. I said yes, actually. The signs and symptoms of breast cancer are they are the same in both men and women. The difference is that women's breasts have more fats in them because they are specialized for feeding the infant. They have more fat and ducts, but the basic anatomy is the same. And so the signs and symptoms are the same. It's just that the incidence of breast cancer is more in women than it is in men.
All right, thank you very much. So the signs of breast cancer are the same in both men and women. Thank you very much for that, Dr. Maduka.
You're welcome.
Okay, I have one question here. Someone is asking, if breast cancer runs in one's family, what can be done to protect oneself from having it? Can anything be done? Dr. Maduka, did you get that? Okay, she has been logged out. I don't think she heard the question. Let's just give her a few minutes. I'm sure she's trying to log back in.
No, I'm sorry about that. Network is poor,
Yes.
quite in the hospital.
Sorry about that, I understand. So I was saying, like, there are a few more questions.
Okay.
Someone is asking, if breast cancer runs in one's family, what can be done to protect oneself from having it? Can anything be done?
Okay. So yes, the answer is yes. Things can be done. Like it was stated in this slide, there are preventive tips that can help with reduction in an individual's chances of getting breast cancer. If an individual knows that, okay, breast cancer runs in my family, what can I do to reduce my chances of getting it? If the individual eats healthy, doesn't smoke, reduces their alcohol, exercises, then the individual will have to do self-breast examinations. They should know the signs. So as soon as they notice something is off, they will go to the hospital and then get evaluated. Because once breast cancer is caught early, the chances of survival are quite high. The prognosis is quite good. So the fact that it runs in the family does not mean that you would get it, first of all. And second of all, if an individual eventually does get it, early detection and treatment is key.
All right. Thank you very much. Thank you very, very much. So there's another question here in the chat box. Someone is asking, is there a link between oral contraceptives and breast cancer? Is there a link between oral contraceptives and breast cancer?
The answer will be both yes and no.
Okay.
In the sense that oral contraceptives are hormonal. or their hormones to help regulate an individual such that they don't get pregnant. But then it can increase the risk. It doesn't mean it causes breast cancer. Same way alcohol can increase an individual risk. It doesn't mean the person will get breast cancer. Same way a woman who does not give birth at all, or can increase the risk, but doesn't mean she will get breast cancer. So some of these things can increase. Studies have shown that they can increase the risk, but it doesn't mean they cause breast cancer.
Okay. Okay, so some oral contraceptives can increase
Yes.
the risk of cancer.
Some, not all.
Okay. Okay. Thank you very, very much. So please feel free if you're participating on YouTube, we are reading your comments. So if you have a question or any comments at all, please use the comment section, the comment box, and drop your comments here. We'll see them. Also, if you're on the website, we are together. So feel free to drop any comments or any questions you have. Thank you. Okay, I have another question here. Someone is asking, can physical activity reduce the risk of breast cancer? Physical activity.
Thank you. Yes, it can. Keeping fit or keeping healthy, maintaining an exercise regimen can actually reduce an individual's risk of getting breast cancer or many other diseases for that matter.
Dr. Maduka, are you still there? I'm not sure I heard you.
Okay, yes, I am. I said physical activity can reduce an
Okay.
individual's risk of breast cancer and so many other cardiovascular diseases. WHO even recommends 10,000 steps a day. So if you can get in those steps and find ways of incorporating physical activity into your lifestyle, it doesn't necessarily mean going to the gym. Just 10,000 steps a day, walking, taking the stairs instead of the elevator, walking that way instead of taking a tricycle can actually help reduce the risk of certain diseases.
All right, thank you so much. So physical activity can help to reduce the risk of breast cancer. Keeping fit has a lot of benefits. So it's time to keep fit. If you've not been doing that, if you've not been exercising or keeping yourself physically active, this is another reason why you should keep yourself active. Thank you very much, Dr. Maduka. So there's another question here. Someone is asking, how often should I do self-breast exam? How often should I do self-breast examination?
Thank you. Okay. Self-breast examinations are actually recommended monthly. For a lady, that would be a few days after the end of their menstrual period or their menstrual cycle, they do a self-breast exam.
Okay, so monthly.
It's recommended monthly, but we've noticed that people don't actually keep to it. So if you can do it as often as you can, even if it's every 3 months, you remember, every 4 months, as long as you just try and do it as often as possible.
Okay, thank you very much. So there's a follow-up question here. Someone is saying, do I need to go to the hospital for breast examination?
Well, when you go, well, thank you. Yes and no. So the thing is, if you can do the self-breast examination yourself, that would be helpful because it reduces the stress of going to the hospital. It takes away that time of going to the hospital. So if you can do it yourself, that is fine. Now, when you notice that something is different in your breast, then you go to the hospital.
Okay. Okay, thank you very much. And like we always say in Health Facts, we are ambassadors of having regular hospital visits. So even before, even if you don't notice any changes in your breast, even if everything is fine, it's still okay to go to the hospital at least once a year for your annual health checkup. So something like, especially if you're a female, something like breast examination is likely to be done on you if you go to the hospital just for follow-up, just for checkup. So once they're checking your body, they will also check the breast and all that. So it won't be bad if you go to the hospital for a clinical breast examination at least twice a year, once or twice a year, even if there are no changes, even if there are no symptoms, no lumps, it doesn't hurt. So, like Dr. Maduka also said, monthly self-breast examination is very important. It could be a lifesaver. It could save your life. It will help you notice lumps very, very early, even before they become apparent. And then another advantage of doing self-breast examination is that it helps you to get familiar with what your breast feels like. Okay, it's true that the breast changes slightly as you get older. Because when you're younger, there's how your tissues are arranged. When you get older, you have less fats, and there's how the tissues are arranged. But every step of the way, if you're doing breast examination very often, you'll be familiar with how your breast feels like. So once you're familiar with the normal, your own normal, it will be very easy for you to notice any changes, even the slightest changes, before it even becomes a lump or before it becomes apparent. Once you notice a change in your own normal, that helps. So doing a regular monthly self-breast examination will help you in so many ways. Thank you so much, Dr. Maduka. Okay, this is an interesting one here. Someone is asking, Angelina Jolie had to do a mastectomy to prevent breast cancer because her mother had it. Does every woman who has breast cancer in the family need to do a mastectomy before one gets breast cancer? Okay, this is an interesting one.
Okay, so
That's
the
an
answer to that is
interesting one.
no. It's actually, the answer is no. So if breast cancer, or if members of a family have had breast cancer, there are tests that an individual can do to find out if they have the gene themselves, because it doesn't necessarily mean they will have the gene because someone in the family has had. So if they do the test and they realize you have the gene, or the common gene we usually test for is BRCA1 gene. So if they do the test and realize that you do have the gene, then what that means is that your chances of having breast cancer is high. It doesn't mean that you will have breast cancer. Having the gene just means that if a person who doesn't have the gene is predisposed, or maybe their chance of getting breast cancer is, let's say, 5%. In an individual that has the gene, their chances can go up to 30%, 40%. So that doesn't mean that they have to have a mastectomy. People do in that case, she did the mastectomy because she wanted to, not because she had breast cancer. So it's not necessary, mastectomies are radical. They are the end of the spectrum care. So an individual who has an increased chance of having breast cancer doesn't need to do a mastectomy. Just having those preventive tips at your fingertip, exercise, diet, and checking yourself regularly and going to the hospital for your regular checkup should be enough to pick up the signs early enough if it does occur, and then to reduce your chances of it occurring. So not everyone who has breast cancer in their family should or is advised to do a mastectomy. I hope that helps.
Yes, I'm sure it does. Thank you so much. Like Dr. Maduka has said several times this evening, she said having a family history of breast cancer does not mean that you will have breast cancer. It's not 100% that you will have breast cancer. It just increases the risk. And like she has said, not everybody will need to have a mastectomy. For those that don't know, mastectomy is a surgical name of like cutting off the breast. So not everybody will have to do that. And like she has said, abroad, Angelina Jolie is a popular American actress. So in that setting, they have the technology to do some chromosomal analysis, and they were able to find some genes that put her at risk of breast cancer. So they decided to do that, and that was her choice also. So it doesn't mean that if you have a family history of breast cancer, that you have to cut your breast off. No, that's not the practice. It's not advisable. Okay, there's one question. Oh, we have a few minutes here, but I think we should just take this question. This will most likely be the last question. Someone is saying, if one has had, if, okay, let me get this straight. If one has been said to be cured of breast cancer, is it possible for it to recur? Okay. So if one has been said to have been cured of breast cancer, is it possible for it to recur?
Okay.
So can breast
Thank you
cancer
for
come
that
and
question.
go? All right, thank you.
Okay. So how breast cancer or how cancers in general work is that once they are diagnosed and treated, there's usually a time frame we give. So if in 5 years we've treated a cancer has been treated, let's say cancer was diagnosed in 2010, we've treated it 2010, we check again 2015, there are no signs, that's a 5-year interval. We say the person has gone into remission. That's what we call it. We don't really say people are cured per se. We say the person has gone into remission, meaning there's no cancer. So there will still be tests depending on your physician or depending on the kind of cancer every 3 years, every 5 years, every 10 years to still check for signs. Although in the last 5 years you've not had signs, we will still be checking from time to time because it's possible that another form of cancer can occur again. But once it's past that 5 years mark, we usually don't call it reoccurrence. I think there's a different term for it. Now I can't remember at this point. But yes, an individual can go into remission or free of cancer. We don't say it's a cure. We just say the individual has gone into remission. There is no cancer. The individual is cancer free. We don't say cure.
Okay. All right. Thank you very much. So Dr. Madhuka said that we usually don't use the word cure, especially when it comes to cancer. Now, hearing that should not get you worried and make you think that, oh, so I should be expecting the cancer back. That's not what we're talking about. People can have treatment for breast cancer and treatment will be successful, and throughout their lifespan, they will not have to deal with breast cancer again. But we're also saying that there's a possibility in some people, due to different factors, they might have another recurrence of cancer, or it may be a new cancer entirely. So I hope you understood that. Thank you very, very much, Dr. Madhuka. This has been a very enlightening session. We're very interesting. We got interesting questions. Thank you so much to everyone in the audience, both on YouTube, on our website, here on Zoom. Thank you for participating in the conversation. And for those who missed this session for one reason or the other, or if you had people you invited that you wanted them to participate in this and they were not able to, there's no problem because we're going to share the link. We'll share the link to our YouTube so that you can always go back and watch it and rewatch the session and learn from it. So once again, thank you very much for joining in. This has been the October edition of HF Live. And in case you don't know about HF Live, you can find us on www.healthfacts.ng. We publish very interesting articles every week, several articles per week. And we also have these events monthly. So I'd like for you to check us out on our website and also our social media on Twitter or X. We are healthfacts_ng_. Also the same username on Instagram. And you can also just simply type Health Facts NG on Facebook and you'll find our page there. Thank you very much for joining in. We'll see you next month, hopefully, for the November edition of HF Live. Thank you so much.